Glenmax Peb is a combination medication that is used to temporarily relieve symptoms caused by the common cold, flu, allergies, or other breathing illnesses such as sinusitis and bronchitis. Antihistamines in this medication help relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. Decongestants help to relieve stuffy nose and ear congestion symptoms. If you are considering using this medication, it is important to carefully read the package instructions to ensure that it is the right product for you. Some products may have similar brand names but different active ingredients with different uses, so it is crucial to choose the right one. It is also important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years. It is not recommended to use this product to treat cold symptoms in children younger than 6 years unless specifically directed by a doctor. Additionally, some products are not recommended for use in children younger than 12 years. It is important to consult a doctor or pharmacist for more details about using the product safely. It is also crucial to follow all dosage directions to decrease the risk of serious side effects. Lastly, do not give other cough and cold medications that might contain the same or similar ingredients, and consider other ways to relieve cough and cold symptoms such as drinking enough fluids, using a humidifier, or saline nose drop/spray. To take Glenmax Peb, simply follow the instructions given by your doctor or on the product package. If you're self-treating, make sure to carefully follow all the directions. Take this medication by mouth, and if you experience stomach upset, you can take it with food. Drink plenty of fluids unless directed otherwise by your doctor. If you're using the liquid form, be sure to measure the dose using a special measuring device/spoon, and if it's a suspension, remember to shake the bottle well before each dose. Do not crush or chew extended-release tablets or capsules, and if you're using chewable tablets, chew them thoroughly before swallowing. If you're using a product that dissolves in the mouth, place each dose on the tongue and allow it to dissolve completely, then swallow it with saliva or water. The dosage will depend on the product you're taking, your age, medical condition, and how you respond to the treatment. It's important not to increase your dose or take this medication more often than directed without your doctor's approval. If your doctor instructs you to take this medication daily, be sure to take it regularly at the same times each day to get the most benefit from it. If your condition lasts for more than 1 week, gets worse, or occurs with a headache that doesn't go away, fever, or rash, be sure to contact your doctor as these may be symptoms of a serious medical problem. Some common side effects of Glenmax Peb may include drowsiness, dizziness, dry mouth, headache, upset stomach, constipation, or trouble sleeping. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. However, many people using this product do not experience serious side effects. It's important to notify your doctor right away if you experience any serious side effects such as mental/mood changes, ringing in the ears, difficulty urinating, or vision changes. In the case of very serious side effects like fast/irregular heartbeat or seizure, seek medical help immediately. While rare, a serious allergic reaction to this drug is possible. Get medical help if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. Remember that this is not a complete list of possible side effects. If you notice any other effects, it's important to contact your doctor or pharmacist for advice. Before taking Glenmax Peb, it is important to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions, so it's crucial to discuss this with your pharmacist. Before using Glenmax Peb, it's important to discuss your medical history with your doctor or pharmacist. This includes any breathing problems, diabetes, glaucoma, heart problems, high blood pressure, kidney problems, liver disease, seizures, stomach/intestinal problems, overactive thyroid, or difficulty urinating. Glenmax Peb may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's advised to avoid driving or using machinery until you know how this medication affects you. Limiting alcoholic beverages is also recommended, and it's important to talk to your doctor if you are using marijuana. For liquid products, chewable tablets, or dissolving tablets/strips, it's important to be cautious if you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit/avoid sugar, aspartame, or alcohol. It's best to ask your doctor or pharmacist about using this product safely. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Children may be more sensitive to the side effects of Glenmax Peb, especially excitation and agitation. Older adults may be more sensitive to the side effects of Glenmax Peb, especially dizziness, drowsiness, confusion, constipation, fast/irregular heartbeat, trouble sleeping, or urination problems. These side effects can increase the risk of falling. During pregnancy, Glenmax Peb should only be used when clearly needed, and the risks and benefits should be discussed with a doctor. This medication may pass into breast milk, and the effect on a nursing infant is unknown. It's important to consult a doctor before breastfeeding. It's important to be aware of potential drug interactions when taking Glenmax Peb. Always keep a list of all the medications and herbal products you use, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Glenmax Peb include antihistamines applied to the skin. It's also important to avoid taking MAO inhibitors during treatment with this medication, as it may cause a serious and possibly fatal drug interaction. Make sure to consult your doctor about when to start or stop taking this medication. Additionally, inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. Always check the labels on all your medicines, as they may contain ingredients that cause drowsiness, and ask your pharmacist about using those products safely. Lastly, be aware that Glenmax Peb may interfere with certain medical/lab tests, potentially causing false test results. Make sure lab personnel and all your doctors are aware that you are using this medication. Remember to always consult your doctor or pharmacist for any concerns about taking Glenmax Peb. If someone has taken too much Glenmax Peb and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. Symptoms of overdose may include irregular heartbeat, hallucinations, fainting, and seizures. When taking Glenmax Peb, it's important to follow your doctor's instructions and not share the medication with others. Make sure to attend all medical and lab appointments as recommended. This will help ensure that you are getting the full benefits of the medication and that it is working effectively for you. If you forget to take a dose of Glenmax Peb on your regular schedule, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take your next dose at the usual time. Do not take double doses to make up for the missed one. When storing Glenmax Peb, make sure to keep it at room temperature and away from light and moisture. It's important not to store it in the bathroom and to avoid freezing any liquid forms of the medication. Always keep all medications out of reach of children and pets. When it comes to disposing of Glenmax Peb, do not flush it down the toilet or pour it into a drain unless instructed to do so. It's best to properly discard the product and it is expired or no longer needed. If you're unsure about how to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.